I want to welcome you to the podcast. I'm Dr. Deborah Durst. I am a double board certified physician that now specializes in regenerative, metabolic, and nutritional medicine. As a return viewer, I want to thank you. I love all the feedback and comments, and we love interacting with them. If you are new to the channel, I hope that you love all the content we're putting out. Please like, subscribe, share with friends, and leave comments so we know what you want to hear about, because we are willing to deep dive into anything wellness or sexual medicine. Thank you. So welcome to RevMD Podcast with me, your host, Dr. Deborah Durst, and my co-host, the one and
only
one and
Third
only.
Eglon nurse practitioner here at Revitalize MD.
So today we have a very interesting topic. So we're going to talk about erectile dysfunction, what that is, and penis pumps, what they are, and do penis pumps work for erectile dysfunction or ED?
And what else are they used for?
Yeah.
Right? Because it's not just for ED.
No, there are many uses. So again, this is a very interesting topic because I feel like our staff, always is asking questions about penis pumps. Our patients are asking. And again, they're used for lots of different things.
And it's part of our comprehensive treatment plans for our male sexual wellness patients and hormone replacement patients.
Yeah, so it's one of those treatments that actually historically goes back quite a ways into traditional medicine, and actually one of the most common devices used by urologists post prostatectomy. But we use it for regenerative procedures, so it's quite effective because we're using it across the board. So what is erectile dysfunction? How common is it? What's a penis pump, and how does it work, and does it work for ED? So erectile dysfunction, the inability to maintain or sustain an erection that can result in sexual activity. So, there is a lot of different causes for it, and it's very common.
Right? And we see more and more of this as men age. So some of it can just be aging. Others can be more related to health issues such as diabetes and hypertension, issues with cholesterol, things that all lead to negative effects on the venous system.
And the blood flow to the penis, yes. So it is strongly associated with age for sure. In the Massachusetts Male Aging Study, which was done in 1994, again, there were like 1,700 patients age 40 to 70. Average age was 52, but again, even back then, they had 152 million men worldwide that had ED. And not with that study, but now there is anticipated in 2025, 322 million men worldwide with ED. So,
and we know a big portion of that's blood flow.
Yeah.
Right? There's also hormones. Hormones do play a part, a smaller part, but it's still 20% of the issue.
Correct.
But 80% is blood flow. So it's what affects blood flow.
Correct. And so those medical conditions you're talking about, if you have high blood pressure, high cholesterol, diabetes, you're on medications, there's things that will affect the blood vessel health. And so therefore your incidence of ED or risk of it increases. So we say about 40% of men at 40, 50% at 50, 60% at 60. But honestly, if you look at some of those studies, it's 100% at 80. So it is a progressive condition. So again, the earlier that you notice symptoms and intervene with some sort of, treatment, the better it is. And
so what are our options for erectile dysfunction?
Yeah. So historically,
traditional options.
Yes, traditional options are historically, again, the urologist, well, I will say it's the number one device used is the vacuum erection device. So penis pump is technically a vacuum erection device, so VED. So that's one. So injections.
Like Trimix.
So,
But mostly we see that post prostate surgery.
Correct.
So these are utilized, it's a medication utilized for men that have no function typically. So for a urologist to prescribe it, it's you are not getting an erection, unable to get an erection, and it's kind of a last-ditch effort medication-wise.
Correct. She's talking about the trimix. So, because the vacuum erection device, again, post surgery, it's almost used for penile rehabilitation.
Yep.
And so that is one of them. And medications came along after that. So now it's the go to because, again, it's the easiest, right?
The little blue pill. We've all heard about it.
Correct.
It's been marketed very, very well.
Very well. And it's effective, but a lot of men have side effects. It is medication with side effects. And so, again, sometimes not all men can take it. So we want to have other options, and injections don't always seem to be a viable option for a lot of men. And so a vacuum erection device or penis pump is a very good non-surgical alternative to that.
Absolutely.
And we do use that as part of our regenerative procedures. So we're pretty comprehensive. And again, regenerative procedures are acoustic shock wave,
Or Gainswave.
Yeah, or Gainswave. P-shot or PRP injections, and then again using the pump as part of that. Again, addressing it from a hormonal standpoint, like Faraday said, 20% of erection issues can be hormonal. The younger you are, it probably plays a bigger part. But again, comprehensively addressing it across the board. So, but what is a penis pump exactly?
And what types are there? What's the hype behind them? And do they actually work? And if they do work, what do they help with? Right? Because that's the questions that we keep getting.
Oh, yeah.
Does this actually work? Should I actually buy one? Do you use a pump that only utilizes and includes the penis, or one that includes the penis and the scrotum?
Correct.
And then, does it work? Why am I doing this?
Yes.
How often do I have to do it?
Yeah. And again, so those are all great questions, and she is correct. We get those on a regular basis. So penis pumps or vacuum erection devices were approved in 1982. So it's been around for a while. It's a Class 2 medical device. So that means FDA approved as a Class 2 medical device. And so there's many on the market. And when we did the
There's a lot.
research for this podcast, you could be hours just figuring out which pump to
Dr.
use.
Durst went down a rabbit hole on erectile
The devices.
vacuum devices.
Yeah, because there's like a ton. So like the basic
Brands,
is manual
function.
or electrical, but again, it is the amount, and there's lots of feedback and lots of reviews, and
Yes.
this one's the best, and they don't like this due to, the type of material, or so it is complex. And so you can
is.
spend hours, and honestly, we're not getting into a specific recommendation for one over the other, because I think everybody has their preference and
Exactly.
price point, honestly.
And honestly, the most effective one is the one that you're utilizing.
Yes, yeah, the one that works for you, the one that's easiest to work for you. So, and we do have one that we use in particular in our office with our Gainswave and P-shot, or our sexual wellness for men packages. But again, we don't need to get into that right now. We are going to have an upcoming video about how to use the penis pump, because again, we get a lot of questions about that. So a go-to video.
Yep.
that
And that'll be
describes that.
step-by-step instructions with the pump that we do utilize in our office. So
Correct.
if you are interested in what we're using with our patients, please feel free to look for that video on our channel. Dr. Durst will be going through step-by-step instructions on how to use it.
Correct. So again, rabbit hole, you can see all kinds, but it is used in urology practices. And again, post prostate surgery or prostatectomy, then basically this can be a penile rehabilitation. So those pumps, the more that you are pumping, and we'll talk about, how that works, but it's a vacuum device that goes, a cylinder that goes on top of the penis. You want a good seal at the bottom of it. And again, we talked about what are they used for. So post prostatectomy, again, just getting erections for sex is one of them.
Yeah.
And for regeneration or better blood flow in during regenerative processes, you can do this as well. But again, you're going to get blood flow in by using something that has a vacuum, but you have to put the cylinder on, create a seal, and then attach the device. It can be a manual, it can be an electric, that is actually going to create a vacuum that brings blood flow into the penis.
So some things to be cautious of, right? So if you're on blood thinners or sickle cell or on
some
high
leukemias,
doses of
yeah.
aspirin, right, you can have bruising. So you need to be careful.
Not, it shouldn't be painful. And so, again,
You're
you should
being too
pump it.
aggressive if it's
Yeah.
painful.
You can pump it up to an erection, and again, with our comprehensive treatments, and again, the timing, how often you do it, how long is going to be variable on what you're using it for, what your doctors want. Again, a medical device is doctor recommended or prescribed. And so you want to use it according to their protocols, but if we want somebody to pump, say for 10 minutes, we want them to get that erection by using the vacuum so that you get the blood flow in and hold it for 10 minutes. But
Yep.
don't be too aggressive if it's painful.
You're
Don't
going
go as
too
high
aggressive.
on a pressure or as long. And again, blood thinning agents, aspirin, leukemia, certain blood, bleeding disorders could be problematic.
And
So,
then also, when you're too aggressive with a pump, you can cause damage to the vessels. So, if it's painful, you're being too aggressive. So, more is not always better. Read the instructions on the pump. It will give you a gauge. It'll say stay within there's red, yellow, green, right? If it's color coded, stay in the green. More is not better. More is actually worse. It can cause damage.
more is not always better.
More is not
Yeah.
always better. This is one of those situations. Or they'll give you a number to stay between, whether it's, staying under 10 or whatever it is that device will give you on a gauge. So definitely read the instructions.
And so I think the big question is, does it work, right? And
Yep.
so when you're talking about penile, again, penis pumps or vacuum erection devices for erectile dysfunction, they work. There are lots of robust studies that actually show and support that it improves erections. And so there are studies in science to support that. And so the use after prostate surgery is good because, again, that's going to get that healthy blood flow in. And that's a time when you have this, kind of period where you're not having erections. But, a lot of times that will recover. But using the penis pump or vacuum erection device is very helpful. So it does work. And
And
we
then
use
there
it.
are some studies
Yeah.
that do show that
The
regular
efficacy of it,
use, there's approximately a 70% increase in erectile function with an 85 to 87% satisfaction rate. So those are pretty high numbers when you're thinking about something that is a non-med, non-surgical, over-the-counter, class 2 medical device that any person with the internet has access to purchase and have delivered to their home.
Yeah, and it can actually be up to about 90% effective in some of those studies. And again, so I think that does it work? It also depends on your commitment to getting
True.
that improvement. And so it's like going to the gym and, wanting muscles after one workout, right? You're probably not
Not
going
going
to
to
get them.
happen.
But, the more that you're using it, and if you're thinking of the penis as a muscle, just thinking of it that way, the more that you're going to use it, the more you're going to get blood flow in, and the better effectiveness.
And the more sustained results. So that
Correct.
study that I was quoting was looking at a year of pumping after a year. So this is a commitment, just like anything that we do. Like Dr. Durr said, you can't go to the gym and work out one day a week and think that you're going to build muscles and be skinny.
Yes.
It's just not how that works, unfortunately. We got to put the work in and you got to be dedicated to it.
Yeah, and so it really is that commitment. And I was very, I guess, enlightened by the satisfaction studies that we saw
Yeah.
because about 50 to 80% of men were satisfied with the treatment of the ED with the vacuum erection device or penis pump. And the partner satisfaction was consistently very high with it, even higher than the men. And so they're happy with it. And so long-term use, it actually increased their sexual activity in the year that they were using the penis pump, but also sustained after that. So it seems to, again, work. Patients are happy with it and partners are very happy with it.
So, all in all, is it worth it? We think yes.
I think this is a very simple purchase that you can make that is non-medical, non-surgical, a very good option if you're starting to notice erection changes. And again, we'll go through a video on which one we use. And, the one that we use has a couple different cylinders. There's reasons why, at least theoretically, that we use that one. But again, it all depends on whether you want to do a manual, whether you want to do an electric, whether sound's an issue, whether, the make of the pump fits, to your satisfaction. But I think it is well worth the investment and commitment.
Absolutely.
So,
There's no quick fix, but this is definitely an easy option you can do at home without a prescription.
yeah, you're creating that vacuum, increasing blood flow. And again, when we do comprehensive treatments for men with erectile dysfunction, and we're doing injections or PRP injections, and we're doing acoustic shock wave to communicate with the tissue until it is injured, we have a pumping schedule that we recommend and highly recommend because the healthier blood flow in, the better. And so
That's the name of the game.
yeah,
The
and
more you use it, the better.
the use it or lose it is true, and it comes to this for sure. And so this is one of the reasons too. And if you don't have a partner, you're noticing changes, this is a very viable option. And again, if you're using it for sexual activity, most of those pumps have with a constriction device at the bottom. So you're putting that constriction device on first, you're creating the seal with the pump, you're attaching the vacuum, device to it, and then that can stay on for sexual activity, which is why there's such a satisfaction. You get an erection. It's not a sex toy. So again, just knowing that, using it and then removing that part, and then you're having sexual activity. And again, those like potential bruising, just knowing it is a medical device. So getting very familiar with it and how to use it is important. And then I think the one thing that we often didn't think about, and we hear it all the time and our patients ask, but the more I looked into, vacuum erection devices and penis pumps, I ran across, again, PE. So,
Oh, yeah. She has her, she's like, do you know what PE is? I'm like, pulmonary emboli?
Yeah.
So where are we going with this conversation?
Yeah, or a physical, exam, or
Right, I'm going through all the
education.
medical reasons.
Yeah, so I didn't even think about, but because we don't market it in this way.
Yep.
And it's actually, again, there's not studies to support that. So if device companies are marketing it in such a way that it says it increases size, but increased size, length, and girth is one of those benefits that a lot of men talk about as far as PE or penile enlargement. And so,
However,
again,
that is not indicated
no.
by any means. And recently, I believe a company did get in trouble for making those claims.
Yes, yeah.
So definitely not able to make those claims, but what we see online, what we hear patients say is that they do see some benefit at times from it.
Yeah. Well, I think it comes down to this. Like, again, medicine is behind. And so the studies don't support a size increase with vacuum erection devices or penis pumps. But again, the science is not always on top of it, and it's not that regenerative procedures don't work. Sometimes you just won't have a very supportive study, and there aren't studies that support that claim, which is why you can't specifically say that happens. And so, but the bottom line is men are talking about it and men are saying it works. And I think sometimes that feedback from men using it and how they're using it and what device and what kind of results they're seeing is very helpful. And that's why there's forums for those discussions.
And we can always start that discussion in our comments.
Correct. So let us know if you are, again, familiar with the penis pump, different uses that you've had, results that you've had, any recommendations on specific, types or
Brands that you've seen
schedules.
improvements with.
Yeah, because
Absolutely.
I think this will be a very interesting conversation to open, and we look forward to seeing all the comments on it.
And that's what's great about these podcasts is that we have them because you guys ask us questions. And then if we can open up that comment space underneath our videos to kind of have those open discussion boards, then it is beneficial for our patients, for our listeners. And then also if there is something that's brought up in those comments, we can make a video on it and elaborate further medically.
We learn from you. We learn a lot.
Regularly.
Yes, like from patients coming into the office, from the comments that are left. We love our feedback that we get, and we enjoy reading it and responding. And again, if there's anything you want to listen to, let us know. If you like the content we're putting out, please like and subscribe, pass it on to friends. We would love that. And let us know what you want to hear because we're willing to deep dive into anything sexual wellness.